Good afternoon, everyone. Welcome to today's session of Nursing Rounds hosted by the UBC School of Nursing. My name is Ash Scott, and I'm delighted to welcome you this afternoon on behalf of the Scholarship of Teaching and Research Committee. As we begin the session, I'd like to acknowledge that I and the University of British Columbia's Vancouver campus are situated on the traditional, ancestral and unceded territory of the Musqueam people. While we're meeting virtually today, many of us are gathered on the traditional lands of Indigenous peoples across what we now call British Columbia and beyond. So I invite each of you to take a moment to reflect on the Indigenous lands you're joining from and to consider your own responsibilities towards reconciliation, equity, and culturally safe practice. Today's presentation is titled Improving Access to Pediatric Symptom Management, Engaging and Educating Healthcare Practitioners to Improve the Lives of Children with Serious Illness in Nepal. And we're honoured to be joined today by Dr. Manon who co-led this inspiring interdisciplinary initiative with her colleague Camara van Breemen, who unfortunately couldn't join us today. This project exemplifies the power of international collaboration, compassion and education in advancing global child health. Dr. Ranger is a pediatric nurse scientist and an assistant professor here at the UBC School of Nursing with a deep commitment to improving outcomes for children experiencing pain. Her leadership in pediatric pain research and nursing scholarship is recognized nationally and internationally. So I'm really excited, and I know you're excited too, to hear about Dr. Ranger's experiences and insights as this important work continues to improve the lives of seriously ill children in Nepal. So please join me in welcoming Dr. Manon Ranger.
Hello, everyone. Thank you, Ash, for this introduction and also for the land acknowledgement. I'm happy to see some familiar names, so that's great. And because we're such a small group, please stop me anytime if you have questions. And I really just want to take this opportunity to share my experience mainly. So the presentation it will be, even though there's a PowerPoint and everything, it's quite informal. And I try to put a lot of pictures so that you can see the kind of work we did together. And Camara needed a long overdue vacation, and so there was an opportunity that she seized to go to spend some time with her daughter, and so she will not be joining us today, and I will speak on behalf of the two of us, well, on behalf of the team actually. So I will share my slides. Hopefully this will work out, because I always wonder if you will be able to see the actual presentation and not the presenter view. So what are you seeing?
Presenter view.
Okay, so that's not working out. So I think that does this change anything?
That's just the slides. That's perfect.
Okay, so perfect. Okay, great. Okay, so I won't re-say the title because it was said, but really it was, I'm really excited to talk about our project because actually this is one of the first presentation that I'll be doing with all, like, even speaking to some of the more recent results that we have. So that's great. So really today, I'm just going to share a little bit of background and context and talk about the aims of the project, the phases, some of the preliminary findings and the potential impact. And also I want to talk about some lessons that I've learned, that we've learned about doing research in collaboratively, internationally, and especially in low middle income countries. And so I'm hoping to share some of my experience because I know that Ruby, who is part of the attendees today, asked me about my challenges, and so I hopefully I'll have some time at the end because I tend to speak a lot. So yeah, and we started a bit late, so hopefully we'll have time. Okay, and so we'll continue. So this is a project that was funded mainly by the Center for International Child Health, which is something that it's an institute, well, a group that is part of the BC Children's Hospital Research Institute. But really, this project was also supported by additional kind of funding support from mainly to World Cancer collaboration, which I was not aware of before starting this project, but also some local funding in Nepal from the TAC. So that's it's the what is it called? Sorry, the Together Against Childhood Cancer, which funds some projects in Nepal and all over the world. And so that's it. So this work could not have been done without additional support because we got $40,000, which may seem like a lot, but it had to be really mostly distributed in Nepal. So 2/3 of the funding needed to go locally, which is great. So not a lot of money could be used for us for locally. We use it mainly to travel there. But and I'll tell you all about it. But so this is just to give you an idea. This is the last cohort of trainees from an in-person workshop. So that was just recently in February when Camara and I traveled back to Nepal to Kathmandu to do our last workshop. So this is our project team. It's an interdisciplinary team of local people and national collaborators, national co-investigators, and then international locally, and even some people are from India. So really a great team. I did not know any of them, except I had met, maybe you would have met, you remember that Justine Bihan came to present about her new role at the BC Children's Hospital because she was the global health research nurse, and she talked about that, and that it was at caucus, and that really kind of planted the seed in my mind. And so I reached out and I said that I wanted to be involved in global health research and how can I help, because the big mandate was also to really help nurses be more involved. And then Camara, from a nurse practitioner and pediatric palliative care expert at Canuck Place, had contacted Justine because there was a possibility of a project and they needed a researcher. And so she thought of me, and so we all connected, and that's how it all came about. So Camara had all the connections. She is very much involved in Two World Cancer collaboration, and she knew Megan, who did a lot of work in palliative care. So Megan is in Ottawa, but now actually with the WHO in Geneva, because she's really well known in palliative care and has done a lot of work all over the world, especially in India, and she's very much involved in Two World Cancer also. And she knew some local people in Nepal, and they were just starting their pediatric palliative care kind of interest and everything. And Dr. Sudhir Sapkota, a pediatric oncologist at Kanti Children's Hospital, was really the one that she had a lot of contact with. And so all together, we came and we put in this grant, and it was luckily funded. And so there my journey began to learn all about I have some background in pain and comfort, so that's my link to the kind of topic, but I was there as the researcher. So but I learned a lot and really have enjoyed this project, and it's just a starting point. Now I'm part of the Two World Cancer Collaboration, and so hopefully my work will continue. And I'm happy to share more information about that. So I'm just going to now talk more about pediatric palliative care. And so, of course, we can't choose where we're born. And in North America, we can cure over 80% of all childhood cancers, with even higher rates of curing for leukemia, which is like close to 95% of children. But in low middle income countries, really the situation is quite different, with cure rates really that are much lower. And around 20 to 30% of children with cancer can be cured. And so really it means that most of them unfortunately die from their disease. And actually when I was doing my PhD back in the day, I did some work in Cambodia on pain, on pediatric pain, doing some teaching. And actually, that's it. I saw that, there was a new diagnosis of a leukemia girl, and people were saying she's going to die, even though if it was somewhere else, like in France or in Canada, it would be different. It was very sad. So unfortunately, yes, the cure rates are much lower over there. And so it's really important that we improve their quality of life. And so that's where palliative care comes in line. And some of you may know what the palliative care approach is, but for those that are unfamiliar, it's an interdisciplinary, holistic approach to care that addresses the physical, psychological, and spiritual needs of both child and their family. So this is particular to pediatrics, but this really the palliative care approach is all about holistic care. And so but in certain culture and countries, the idea of palliative care continues to be really misunderstood, and there's a lot of taboo, a lot of and also often like there's linked to that, it's all about there's a lot of pain and comfort management. And so in some countries, there's limited access to opioids, and also, of course, some misconceptions about their use and the worry that it will hasten the death. So there's still a lot of work regarding that. But our hope was that by engaging clinicians, teams at really the ground level, to start really using the palliative care approach, we can show how it can improve the lives of the children living with a serious illness. And that doesn't just apply to cancer. We often think about this population, especially when we're talking about palliative care, but really it is for all individuals that live with a chronic serious illness that may lead to a death. So why Nepal? Where there's at least 43,000 children in Nepal that live with serious illnesses, and that really would benefit and need pediatric palliative care. Even though it's a small country, there's a lot of remote places, and it's there's big mountains, and so it's not really easy. It's very difficult to access these remote places, and they have limited access to pain and symptom like assessment and management. There's a lack of knowledge about that. So Two World Cancer Collaboration has been part of this project with us, and they had formed relationships and partnerships not only in Nepal but in the surroundings in India, Sri Lanka, Philippines. They do a lot of work, but in Nepal since 2000, actually, they were involved, and they have established palliative care units in major oncology hospital and worked with volunteers. But now there was like a need to really focus on pediatric. And so there was the beginning at the Kanti Children's Hospital, where, as I mentioned, our co-PI, Dr. Sudhir Sapkota, or Dr. Sudhir, was really interested in moving forward and in creating and training healthcare providers in pediatric palliative care. So our project aims, well, there were two aims. It was first to train and support healthcare providers to provide pediatric palliative care and symptom management across. The approach was that we would do some shared care centers in Nepal. So really the hub would be Kanti Children's Hospital, and then there would be some shared care centers. And then our second aim was to create and deliver sustainable pediatric palliative care nurse leadership program. So really our second aim was focused on training nurses, the champions, so that they would become leaders and they would train other nurses, and it would become this big leadership program. So first I'll talk about aim 1 and then I'll talk about aim 2. So how did we try to achieve our first aim? Well, in 3 ways: to teach and learn from each other, and to enhance knowledge dissemination. That was like our focus. That's what we wanted. It was not about us, you know, people from North America with a lot of experience and also all the opportunities that we have and the technology and that to come and train them to apply those things. No, it was to learn together and to train local people so that they could train and disseminate. And so we first ran a virtual echo series on pediatric palliative care in the spring of 2023. And I will speak to that for those that are not familiar with what echo means, but virtually it was training through this platform online. It was a 9-week series of weekly sessions. And then we traveled 2 times to Nepal to run master classes. So in-person 2-day workshops with 2 cohorts of a mix of physicians and nurses on various pediatric palliative care topics. And then third was really to advance the nursing palliative care training and mentorship. So that's it. And then the idea was that, you know, we would train at the center of excellence, and then they would then train in the shared care hubs, because the idea is that, you know, because there's like Kathmandu is the capital, but there's a lot of other I don't know if they're called provinces actually, but regions, and then there's like these hospitals there that you can they become these shared care centers, and then they would train their people there, and it would also create this kind of like network of people that can work together, that can share knowledge, that can share experiences, and it supports the movement. So what is an echo? And so this is like, these are just pictures of it's really a cool, I was not aware of that. I participated in it, but actually did not really teach anything. I was just there to learn. But it's like a platform that people come together each week to it was through Zoom. And so it's a Zoom session. And then but the platform is where you put all the information, the presentation, the material, and then during the week, the attendees, the trainees, they can access the material. They can watch the videos before, and then when they come to the session, that was an hour and a half, and it was quite difficult. Well, not difficult, but it was challenging because there's the time difference that we had to deal with, but also some people were in Ottawa, we were in Vancouver, and then the trainees were in Nepal, and so it was just, and then some people even came from India to do some guest lecturing, because it was like really local people. Most of them were doing the presentations. Anyway, I won't go into detail with that, but that was the first thing. And there's echo sessions that are ongoing, but it was the first session, I think, like that we did was for 2.5 months. And I think there was like about 40 people that attended. So it was like really, really great. Nurses and physicians. And so collaboration is so important when you do these projects. And one great thing that was a very major positive component of our project, that was not initially, he was not part of our team, but became a big part of our team, actually even more so now, was the addition of Dr. Biplav, who was a pediatric palliative care fellow with Two World Cancer Collaboration, because they run a 1-year fellowship to train physicians to become a pediatric palliative care experts. And so he became a co-investigator with us, because through his fellowship, he actually did a lot of work with us, and then became this expert, and did even the second workshop that we did recently, he was the one that ran it basically, and now he's become really the pioneer, pushing forward many things at Kanti Children's Hospital. But I have really enjoyed working with him. So through my kind of like expertise, because I was like really the researcher. That's what everybody was telling me. The researcher, she knows what she's doing. And actually I wasn't, because doing research in Nepal, in low middle income countries, I had never done. And so I really was, I don't know what I'm doing. We'll see what we can do, what we can achieve. But I learned so much and met incredible people that are so dedicated to improving the care and pain and palliative care in with children over there. So really, for me, I learned much more than I gave. And so, but just to come back, sorry about this thing. So through his fellowship, he had to do a research project. So what he decided was to he wanted to see the effect of learning through the ECHO project. So he developed this survey to do a pre-post test. And so that was great, because this helped us also, because we wanted to measure the knowledge and learn about what was their experience of the trainees through the ECHO sessions. And so this was a win-win. And so with my expertise, I helped him develop the survey, but also he was supervised by one of our co-investigators, Dr. Spandana Rayala, who is the educational lead at Two World Cancer collaboration. And so together we worked, and this great survey came about, and it was used to measure the effects of the echo training session. And so how he built his survey questionnaire, well, he did a thorough literature search on similar surveys, and then he adapted, he created this survey, did multiple rounds of discussions with, experts also for the content, and even a statistician. And then he did some content validation with national and international experts, and he did some pilot testing. And so that's, and he learned all about that also, so through his fellowship. And so what did we find out with our pre-post-test echo survey? Well, so I mentioned how it was developed, and then the survey had 11 questions to assess the knowledge of palliative care in the participants, and there were also 8 questions on comfort level and attitudes regarding pediatric palliative care. And then so the pre-survey was administered right at the beginning of our echo session in May 2023, and then after the post survey was administered in July when they were finished. There were 40 healthcare practitioners that participated. About half were nurses, half were physicians, and there was a statistically significant improvement in knowledge and attitudes towards palliative care, pediatric palliative care, which is great. And some of the barriers that were identified were lack of clinical training, limited pediatric palliative care staff, and infrastructure. And so, and this was not surprising, but this is what it resulted in the survey. So as I mentioned, the idea was that, okay, we're going to do some training at the hub, the main place, the center of excellence at Kanti Children's Hospital, which is in the capital province, and then there were like these shared care centers that were identified not by our team, not our like local team here in Vancouver, but it was really identified by the people in Nepal. And then there were like these key people in each shared care centers, and then the idea was that some people would travel and do some training, some local training, not by us, but by the local the Nepali people. And so the first in-person workshop took place in October 2023. So myself, Camara, and Natasha, who is an oncologist at BC Children's Hospital, and also palliative care, pediatric palliative care expert, and works also at Canuck Place. So the 3N has been involved with Two World Cancer. We traveled together. They mainly gave the workshop with Dr. Sudhir. And I will speak to that in the next slides. And then there was another training that was asked by the local people, and it was followed in November. And there was also a visit at one shared care center. I think it was in Pokhara. And it was through our co-investigator, Megan, and some collaborators that went and did some teaching. And so, but this was not part of our project per se. It was just like added on. So for our first training at Kanti Children's Hospital, you see some pictures of us. They like to take a lot of pictures, people there. And actually, I don't know if some of you have experience doing some workshops and training in certain countries, but I saw very similar traditions from what I had experienced in Cambodia. But when there's a big, it's quite formal when you do these workshops. There's like the people get certificates, and there's a ceremony at the beginning. All the heads of the hospital, very important people come and they give a speech. It's very important. And then at the end, there's again the same people come back, and the certificates are given, and people take pictures. We receive gifts. It's like really this big event. And so it really people feel that it's important, and that what they've learned and gone through, they take it very seriously, and it's really important for them. And so it's really important to us also, and it was great. And so you see some of the participants, it was a mix of physicians and nurses. We had 16 attendees in total, and they came from oncology, surgical recovery room care, cardiology, the PICU, and not just from Kanti Children's Hospital, but mostly. And so, and on the right side, you see a picture of, it was like a simulation of a difficult a discussion. And so they had scripts, but these are two nurses from the oncology department. And so they were doing the scripts. Most of the teaching was done in English because it was ran by us, but their English is very good, but still there is a language barrier. And so that was one of the things that came out of what we've learned from doing this training. Okay, so how did we evaluate that first workshop? Well, we did some focus groups. And so the aim was to really just understand their experience of doing this workshop, and understand more their experience now of, like, since the workshop, of providing pediatric palliative care. So what were the facilitators and the barriers, and also their like new perception about their perception about receiving this training from us. And so the idea was that, okay, when we went to do the workshop, we were supposed to do the focus groups right there at the end. So I did the consenting, and so 11 had consented out of the 16 to be interviewed. But due to logistics, and actually they didn't have ethics approval there, so we couldn't do the focus groups. And so eventually the focus groups were done online on Zoom, and it ended up being just 2 focus groups with 3 physicians in one focus group, and then 3 nurses in another focus group. So, you come on with your researcher very, okay, this is how it's supposed to be done, and then you have to be flexible. And so that's a lesson learned. But on the right side, the picture that you see is during the workshop, we had put all these things on the walls, and people could write things. And one of the questions that we had asked was, what are some barriers to pediatric palliative care? And so you can see lack of time, no focus team, lack of manpower, difficult to convince hospital management, financial language barriers. So some of these are, apply to anywhere, and like lack of time, difficult to convince, because like some hospitals don't have a dedicated team of palliative care. And so this is this is some of the barriers that they had identified. Of course, we can't change some of them, but hopefully through education and empowerment and creating these leaders, things could change or improve. So what did we find with our analysis of the first focus groups? And again, this is just preliminary findings, but one of the major theme was that they emphasize on the importance of a dedicated palliative care unit with trained staff to provide quality palliative care services, and also that really the education, training that they received either through virtual or in-person components, whatever, it really improved the healthcare providers' communication and counseling skills, because this is quite challenging. And we asked them if, the fact that it was given in English, if it was a barrier. And they said that no, it wasn't a barrier to their learning, but that given that, the sensitivity that is required to have these difficult conversations about palliative care with their patients and families, that communication and counseling modules would, it would benefit them if they were translated into local languages so that they could really practice in their own language. And also that was specific to the physician. They expressed the importance of further expanding their training, that the training should be expanded to the whole team, involving even junior doctors, senior doctors, and so they really said that there was a need for more training. And they also said that they were needing some more hands-on practice and feedback from experts. So they told me we don't know if what we're doing is okay, and so that's why the next action point was that we should do some and observations and do some training in person, on site, doing some bedside mentorship and clinical debriefing. And so that was done through our co-investigator, Dr. Spandana. And so she was visiting to do some other networking activities. And so she said, okay, I can do and do some work there with the local people that had been trained in the first workshop. So she visited in July and August of 2024. And so the next step was to, as I mentioned, do that mentoring in July and August. And then also there was a consideration for a new ECHO session and then also to reach more of the shared care centers, because it's virtual. That's where we can actually kind of move forward the whole idea with the shared care centers, because these people from those shared care centers can just join the ECHO because it's online. And so that way, at least they can get some of the training. And then there was also the idea that we would return in February 2025 to do one last workshop and do again some evaluation and networking. And so, the picture on the right is our first visit in 2023. You can see myself, Natasha, and Camara with some local nurses. And so this is actually at Baktapur, a cancer hospital, which is a whole hospital dedicated to cancer care. And they have a pediatric oncology ward there. And so we visited that ward And you can see that they do have some technology like monitors and everything. And actually that hospital, compared to Kanti Children's Hospital, which is really the main big, it's the only pediatric hospital in the whole country. That's the main pediatric hospital, but it has less like funding. It's more limited. So, but we had the chance to visit Bhaktapur Cancer Hospital, which is in Kathmandu, but in another like part of the city. Really nice, really great place. And actually, at the cancer hospital, they have a palliative care unit, and so that's why we had visited there, and then we went to see the oncology ward. And two nurses from that ward participated in our first workshop and were part also of the focus groups. So February, no, I put November because it wasn't November. It was because that didn't even happen yet. It's so that's a typo. It was in February, in the winter, and so we returned this time just Camara and I, because Natasha was expecting a baby. So this was great, but unfortunately she couldn't join us. So it was just Camara and I, and this is a picture of the whole cohort of the last training session. And this is a official picture, and you can see the important people sit in the front on the couches. And so the people that are sitting on the couches are the heads of the hospital, of different departments that had come at the end to give these speeches, and in the back are great trainees. And the great thing about this compared to the other one is that most of the teaching was done in Nepali, also by our super leaders, super trained experts now, one of which is a nurse, an oncology nurse that had gone through the echo, did the first workshop, and I will speak to that in the next slides, but went through the leadership program. And she is the nurse, and they call nurses in Nepal sisters. So Sister Bandana is our super duper champion nurse. She's an oncology nurse, and she is really moving forward pediatric palliative care. And so she did some teaching. She is holding some great laminates with pain scales that they are now using on the oncology ward. And so it was really great to see her, and I was so happy. And so in this workshop, we had 13 attendees, again, a mix of RNs and MDs. Oh shit, I'm seeing the time. And so I will go quickly to finish off. So they were, again, from surgery, NICU, even oncology, and again, not just from Kanti Children's Hospital. And so at that last workshop, I did some focus group in person with people from that attended the first workshop, and so to see how it has been going for them. So after 15 months of going through the training, but actually, and this I can speak to that. I was supposed to speak to that later, but the thing is that, okay, I don't organize these focus groups. It was done through BIPLAV, and they provide lunch, and so people come, and so it's like people that, I didn't even have gone through the workshop. They did some echo at one point, and so just people showed up, and so I but whatever, the more the merrier, the more input you get, the great, you know more about their challenges and receiving um, education and everything. So it, in the end, it was great. So the focus groups, there were two focus groups, and it was this time around, it was mixed MDs and RNs. And so the first, so a total of 11 people participated, 5 in the first and 6 in the second. And it was like 7 physicians and 4 nurses. And so, of course, like nurses, there's a lot of hierarchy still over there. Actually, like I saw in some departments, nurses still wear like the white hat, and they have different colors for their different levels. It was just like, oh my God, yes. But so, but I made sure that everybody had a voice. So sometimes I would even address some people so that I would know more about their input. But it was really nice. And there were some language barriers, but mostly people, it was good. And so we're again still and analyzing the results. But what came out of that second focus group is that they're really seeing that it's really important. The education that they have gotten is really important, and they try to disseminate. They see the impact that it does on the families and on their patients, but they still have some barriers, especially for physicians that are not part of oncology. Like there was one physician that was a cardiologist, and he had to have these serious conversations with families about a heart defect, and he said there was like no space to have these difficult conversations. And so that was a challenge, and they all said that there should be like really a dedicated pediatric palliative care unit or like team, and that's what is being created now, which is great. And so through the palliative care team, so BIPLAV, Bandana, there are the ones that are like pushing this forward. They, in the outpatient clinic, there's like a room for that where they see patients, and then through in that room they can like have these, like let's say that cardiologist that want to have a serious conversation, there's like some sharing, but again it's not every day, and there's no, so it's limited. Quickly, the create the delivery of the sustainable nurse leadership program. So that happened. There was 2 nurses that were sent in last year in April, 1 month in Hyderabad. I'm sorry, I have a hard time saying it. They say it much better. Hyderabad. Anyway, in India, there's through Two World Cancer Collaboration, there's they train fellows there, mostly physicians, but they have a program for nurses also. So 2 nurses, one of which is Bandana, and the other nurse is Nurse Nirmala, who is a nurse in the surgical ward. They were, we don't choose them, they were chosen by the hospital to go there. And then when they came back, we did some interviews with them to learn about their experience and what they've learned. And now they're really heading, especially Bandana, she's like our key champion. And so when we did the workshop the second time around, they were doing the simulation, and also really like it's all about celebrating and empowering nurses through education and mentoring. So these are all great nurses that I've met that do incredible work. And you can see on the right side, Bandana, we were asked when at the last workshop to go and teach nursing students that were doing their pediatric rotation. And so I asked Bandana, would you like to do the teaching instead of us? And so she was like, oh, and then she did it. I said, you're really great, and you know all these great things. And so she did the whole teaching on pain management and assessment. And so it's really great. It's been such an inspiring, life-changing experience. And so the impact and the lesson learned are there, but really my lesson learned is, well, of course, like really, you need a team, and what helped was that the relationships were already there, and we just like enhanced them, and we created new ones. And you have to be flexible, um, and you have to adapt. You have to seize the moment and celebrate the successes. And also, like for me, what the big aha is that I was there to, like, with my researcher, you're the researcher, measure this, evaluate that. It's important, but then I realized, the the rigid research principles, it's not feasible. You just have to adapt, and you just can do like it, and it's not really useful in the end if you want to just evaluate the impact of what you're doing. It's already something. Most of the time, projects like this don't get evaluated, so at least we are evaluating, we are getting feedback, and now it's just about reporting that and disseminating what our experience also. So I saw it now more as a QI project than a full-on research, project with like very rigid research principles. And that's it. So I think that I should stop because it's one, and I'm sorry, but we started late. So, but yes, and I have so much to say, so much and I'm happy to share my more of this if somebody wants to meet with me, talk about it. But these are some contact information. I think the slides will be. I can share the slides. Happy to. And there's a palliative care podcast that is from the Sunflower Children's Network, which is like the part that focuses on pediatric palliative care, part of Two World Cancers. They interviewed me, so if you're interested in knowing more about my experience and what we did, you can listen to it. It's about, I think, like 30 minutes. But there's these, if you're interested in doing more work, and also applying for the global health funding. I am happy to share that also, my experience. And I'm very thankful for the help of two undergraduate students, Ruby Willett, who I don't know if she is still here, but a recent graduate of our program. She really helped me with the transcripts. And Sean Tai, a neuroscience undergraduate trainee in my lab, who is very interested in this work and has helped me also and will help me in the future. So thank you very much for your attention. I'm sorry I talked so much, but yes.
Thank you very much, Manon, for such an inspiring talk. Well, thank you very much for joining us, everybody, and have a great afternoon.
Yes, thank you, Ash.
You're very welcome, Manon.